Have you ever been curious about what drugs are under the chemotherapeutic agents? Well, in this short video we will be talking about these drugs and how they affect the body. Chemotherapeutic drugs are used to destroy both organisms that invade the body like bacteria, viruses, parasites, protozoa, fungi and abnormal cells within the body like neoplasms and cancer. What are the subsystems under the chemotherapeutic agent? First is antibacterial agents that are designed to decrease the population of invading bacteria to a point at which the human immune system can effectively deal with the invader. The first drug under antibacterial is aminoglycosides, which are a group of powerful antibiotics used to treat serious infections caused by gram-negative aerobic bacilli. Aminoglycosides include amikacin, amikin, gentamicin, garamicin, kanamycin, Cantrex, neomycin, misafradine, streptomycin, generic, and tobramycin, Tobrix. The prototype of aminoglycosides is gentamicin with the brand name of garamicin. It's indicated for the treatment of serious infections caused by susceptible bacteria. It's contraindicated in patients hypersensitive to drug or other aminoglycosides. Second drug under antibacterial is carbapenems, which are a relatively new class of broad-spectrum antibiotics effective against gram-positive and gram-negative bacteria. Carbapenems includes doripenem, Doribax, ertapenem, Invans, and imipenem-cilastin, Permaxtin. Prototype for carbapenems is ertapenem. It is indicated for treatment of community-acquired pneumonia, complicated gastrointestinal infections, complicated intra-abdominal infections, skin and skin structure infections, and acute pelvic infections caused by susceptible bacteria. Its drug action inhibits protein synthesis in susceptible strains of gram-negative bacteria, disrupting functional integrity of the cell membrane and causing cell death. It is contraindicated in patients hypersensitive to any component of the drug or to other drugs in the same class and in patients who have had anaphylactic reactions to beta-lactams. The adverse effects are headache, dizziness, nausea, vomiting, pseudomembranous colitis, rash, pain at injection site. Drug-drug interaction are fobenicid, which may reduce renal clearance and may increase half-life, and valproic acid, which may decrease valproic acid levels leading to loss of seizure control. Nursing interventions includes monitoring renal, hepatic, and hematopoietic function during prolonged therapy, telling patient about adverse reactions, and telling the patient to alert nurse if discomfort occurs at injection site. The third drug is cephalosporins, which has 4 generations. The first generation drugs include sulfhydroxyl, Duracef, cefazolin, Ansev, Zolocef, and cephalexin, Keflex, Biocef. The second generation drug includes cefaclor, Kecler, cefoxidin, Mafoxin, cefprozil, Cefzil, and cefurazime, Ceftin, Zenicef. Third generation drugs include ceftonir, Omnicef, cefoperazone, Sfobid, cefotaxime, Clafrin, cefpodoxime, Vantin, ceftazidime, Septaz, Tazocef, ceftabutin, Sadax, ceftazoxime, Cefazox, and ceftriaxone, Rosafin. The fourth generation drug includes ceftizorin, Spectracef, and cefepime, Maxipime. The prototype for cephalosporins is cefaclor. It is indicated for the treatment of respiratory, dermatological, urinary tract, and middle ear infections caused by susceptible strains of bacteria. It inhibits the synthesis of bacterial cell walls, causing cell death in susceptible bacteria. Its adverse effects are nausea, vomiting, diarrhea, rash, superinfection, bone marrow depression, risk for pseudomembranous colitis. It is contraindicated in patients with cephalosporin hypersensitivity or sulfamycin hypersensitivity. Its interaction is that in abacavir, cefaclor may decrease the excretion rate of abacavir, which could result in a higher serum level. In abciximab, the therapeutic efficacy of abciximab can be decreased when used in combination with cefaclor. Nursing interventions include the need lead to seizures, pseudomembranous colitis, diarrhea, phlebitis at intravenous site, anaphylaxis, to assess infection and allergies, to obtain cultures prior to therapy and to monitor bowel function. Next drug is penicillins and penicillinase-resistant antibiotic, which include penicillin G benzathine, Bicillin, Permapin, penicillin G potassium, Pfizer-Pin, penicillin G procaine, cristicillin S, penicillin V, Vetids, amoxicillin, amoxil, Trimox, ampicillin, principin, and ticarcillin, Ticor. Indicated for the treatment of infections caused by susceptible strains of bacteria, post-exposure prophylaxis for anthrax, treatment of Helicobacter infections as part of combination therapy. It inhibits synthesis of the cell wall in susceptible bacteria, causing cell death. Adverse effects are nausea, vomiting, diarrhea, glossitis, stomatitis, bone marrow suppression, rash, fever, superinfections, lethargy. Next drug is sulfonamides, which include sulfadiazine, generic, sulfasoxazole, gantricin, sulfasalazine, azolfidine, and catrimoxazole, Septra, Bactrim. The prototype is catrimoxazole with the brand name of Septra and Bactrim. It is indicated for the treatment of urinary tract infection, acute otitis media in children, exacerbations of chronic bronchitis in adults, traveler's diarrhea in adults, and pneumocystis carnii. Pneumonia when caused by susceptible strains of bacteria. It blocks 2 consecutive steps in protein and nucleic acid production, leading to inability for cells to multiply. Contraindications: cotrimoxazole is contraindicated in patients with a known hypersensitivity to trimethoprim or sulfonamides and in patients with documented megaloblastic anemia due to folate deficiency. Adverse effect: nausea, vomiting, diarrhea, hepatocellular necrosis, hematuria, bone marrow suppression, Stevens-Johnson syndrome, rash, urticaria, photophobia, fever, chills. Drug-drug interaction: warfarin, potentiates the anticoagulant activity of warfarin. Phenytoin, prolongs the half-life. Methotrexate, a folate supplement, should be considered. Nursing considerations includes patients who are having long-term therapy need regular blood count assessment and BSP, and women of childbearing age inquire about last menstrual period. Lastly, monitor the patient for CNS toxicity, nausea, vomiting, diarrhea, liver injury, renal toxicity, and bone marrow depression. Tetracycline includes dimeclocycline, diclomycin, doxycycline, Jorix, Periostat, minocycline, minosin, tetracycline, sumicin, panmycin, cycline, which is indicated for the treatment of various infections caused by susceptible strains of bacteria, acne, when penicillin is contraindicated for eradication of susceptible organisms. It inhibits protein synthesis in susceptible bacteria, preventing cell replication. Its adverse effects are nausea, vomiting, diarrhea, glossitis, discoloring and inadequate calcification of primary teeth of fetus when used in pregnant women. Contraindicated in patients hypersensitive to these drugs. Drug-drug interaction: abimetiapir will increase the level or effect of tetracycline. Tetracycline decreases effects of amoxicillin by pharmacodynamic antagonism. For nursing interventions, administer oral medication on an empty stomach, 1 hour before or 2 to 3 hours after meals. Culture infection before beginning drug therapy. Many resistant strains have been identified. Antimycobacterials, which includes anti-tuberculosis drugs and leprostatic drugs. Anti-tuberculosis drugs include isoniazid, nitrazide, rifampin, rifidin, pyrazinamide, generic, ethambutol, myambutol, streptomycin, generic, and rifapentine, Priftin. Leprostatic drugs include thalidomide, thalamid. Prototype is isoniazid, which is indicated for the treatment of tuberculosis as part of combination therapy, prophylactic treatment of household members of recently diagnosed tuberculars. It interferes with lipid and nucleic acid synthesis and actively growing tubercle bacilli. Its adverse effects includes peripheral neuropathies, nausea, vomiting, hepatitis, bone marrow suppression, fever, local irritation at injection sites, gynecomastia, lupus syndrome. Ketalides, which has the prototype of telithromycin with a brand name of Ketok. It is indicated for the treatment of community-acquired pneumonia caused by susceptible bacteria. It binds to bacterial ribosomes, altering protein function and leading to bacterial cell death. Its adverse effects include headache, dizziness, nausea, vomiting, pseudomembranous colitis, and superinfections. Telithromycin is contraindicated with known allergy to any component of the drug or to macrolide antibiotics and BSP, with known congenital prolonged QT interval, bradycardia, or any proarrhythmic condition such as hypokalemia. For drug-drug interaction there is a risk of increased serum levels of telithromycin and potentially serious adverse effects if it is combined with pimzide, simvastatin, lovastatin, or atorvastatin. Lincosamides, which has the prototype of clindamycin, Cleocin, it is indicated in the treatment of serious infections caused by susceptible strains of bacteria, including some anaerobes, useful in septicemia and chronic bone and joint infections. It inhibits protein synthesis in susceptible bacteria, causing cell death. Its adverse effects include nausea, vomiting, diarrhea, pseudomembranous colitis, bone marrow suppression, hypotension, cardiac arrest with rapid foreign fusion, rash, pain on injection, abscess at injection site. It is used with caution in patients with hepatic or renal impairment, which could interfere with the metabolism and excretion of the drug. Nursing intervention includes monitor the patient for pseudomembranous colitis, bone marrow depression, pain, and CNS effects. Last antibiotic drug is macrolides, which has the prototype of erythromycin. It is indicated for the treatment of respiratory, dermatological, urinary tract, and GI infections caused by susceptible strains of bacteria. It binds to cell membranes, causing a change in protein function and cell death. Abdominal cramping, vomiting, diarrhea, rash, superinfection, liver toxicity, risk for pseudomembranous colitis, potential for hearing loss. Next is antiviral drugs that prevent the viral replication of respiratory viruses and can be used to prevent or treat influenza A or other respiratory viruses. Agents for influenza A and respiratory viruses include amantadine, Semetrol, oseltamivir, Tamiflu, ribavirin, Virazole, Ramantadine, Flumidine, and zanamivir, Relenza. Prototype summary of Ramantadine. It is indicated for prophylaxis and treatment of illness caused by influenza A virus in adults, prophylaxis against influenza A virus in children. It inhibits viral replication, possibly by preventing the encoding of the virus. Adverse effects include lightheadedness, dizziness, insomnia, nausea, dyspnea, orthostatic hypotension, depression. The drug should not be used by nursing mothers because it crosses into breast milk and can cause toxic reactions in the neonate. Use in children should be limited to prevention of influenza A infections. Patients taking Ramantadine may also experience a loss of effectiveness of aspirin and acetaminophen if these are also being used. Monitor patient response to the drug and monitor for adverse effects. Interfere with viral DNA replication are used to treat herpes infections and CMV infections. Drugs that are used to combat this infection includes acyclovir, cidofovir, famciclovir, foscarnet, ganciclovir, valacyclovir, and valganciclovir. Prototype summary of acyclovir with a brand name of Zovirax. It is indicated for the treatment of herpes simplex virus, HSV, 1 and 2 infections, treatment of severe genital hospital infections. It inhibits viral DNA replication. Its adverse effects include headache, vertigo, tremors, nausea, vomiting and rash. It is contraindicated in patients with known allergy to antiviral agents, with renal disease, and with severe CNS disorders. Drug-drug interaction, the risk of nephrotoxicity increases when agents indicated for the treatment of herpes and CMV are used in combination with other nephrotoxic drugs. Nursing interventions includes monitor renal function tests periodically during treatment. Monitor patient response to the drug. Monitor for adverse effects. Next subsystem is antifungal agents. Fungi can cause many different infections in humans. Fungi differ from bacteria in that a fungus has a rigid cell wall that is made up of chitin and various polysaccharides and a cell membrane that contains ergosterol. Chemical antifungals, Its prototype is fluconazole with the brand name of diflucan. It is indicated for the treatment of oropharyngeal, esophageal, and vaginal candidiasis, cryptococcal meningitis, systemic fungal infections, prophylaxis to decrease the incidence of candidiasis and bone marrow transplant. It binds to sterols in the fungal cell membranes, changing membrane permeability. It is contraindicated in patients hypersensitive to drug. Contraindicated with CYP3A4 substrates that may lead to QT interval prolongation. Nursing considerations include monitor LFTs and discontinue drug if hepatic dysfunction develops. Monitor potassium level. For topical antifungals, the prototype is clotrimazole with the brand name of Lotrimin. It is indicated for the treatment of oropharyngeal candidiasis, prevention of oropharyngeal candidiasis in patients receiving radiation or chemotherapy. It binds to sterols in the fungal cell membrane, changing membrane permeability and allowing leakage of intracellular components, causing cell death. Its adverse effects include nausea, vomiting, abnormal live-in BSP, stinging, redness, urticaria, edema, lower abdominal pain, urinary frequency, burning or irritation in the sexual partner. It is contraindicated for patients hypersensitive to drug and for ophthalmic use. Nursing interventions include watch for irritation or sensitivity, stop if irritation occurs, and notify prescriber. Antiprotozoal agents. A protozoan is a parasitic cellular organism. Its life cycle includes a parasitic phase inside human tissues or cells. Malaria is the most common protozoal infection and is spread to humans by the bite of an Anopheles mosquito. Antimalarial agents attack the parasite at the various stages of its development inside and outside the human body, and which is indicated for the treatment and prophylaxis of acute attacks of malaria caused by susceptible strains of Plasmodium, treatment of extraintestinal amoebiasis. It inhibits protozoal reproduction and protein synthesis. Its adverse effects include visual disturbances, retinal changes, hypotension, nausea, vomiting, diarrhea. Symptoms. The next prototype for antiprotozoal agents is metronidazole with the brand name of Flagyl. It is indicated for acute intestinal amoebiasis, amoebic liver abscess, trichomoniasis, acute infections caused by susceptible strains of anaerobic bacteria, and preoperative and postoperative prophylaxis for patients undergoing colorectal surgery. It inhibits DNA synthesis of specific anaerobes, causing cell death. Adverse effects include headache, dizziness, ataxia, nausea, vomiting, metallic taste, diarrhea, darkening of the urine. Next subsystem is antihelmintic agents that affect metabolic processes that are either different in worms than in human hosts or are not found in humans. These agents all It is indicated for the treatment of whipworm, pinworm, roundworm, and hookworm infections. It irreversibly blocks glucose uptake by susceptible helminths, depleting glycogen stores needed for survival and reproduction, causing the death of the helminth. Adverse effects include transient abdominal pain, diarrhea, fever. Contraindicated in patients with known hypersensitivity to benzimidazole class of compounds, in pregnancy, and in children LT, 2 years of age. Drug-drug interaction includes phenytoin or carbamazepine that causes lower plasma concentrations, cimetidine that increases plasma mebendazole concentrations. Nursing interventions include initiate second course of treatment if cure does not occur within 3 weeks and examine and treat all family members simultaneously because pinworms are readily transmitted from person to person. The next subsystem is anti-neoplastic agents, which can work by affecting cell survival or by boosting the immune system in its efforts to combat the abnormal cells. For alkylating agents, the prototype is chlorambucil with the brand name of Leukerin. It is indicated for palliative treatment of chronic lymphocytic leukemia, malignant lymphomas, and Hodgkin disease. It alkylates cellular DNA, interfering with the replication of susceptible cells. Adverse effects include tremors, muscle twitching, confusion, nausea, hepatotoxicity, bone marrow suppression, sterility. See.
Chlorambucil should not be used in patients whose disease has demonstrated a prior resistance to the agent. Nursing intervention includes lab tests, CBC, HGB, total and differential leukocyte counts, and serum uric acid initially and at least once weekly during treatment.
Prototype for anti-neoplastic antibiotics is doxorubicin, adriamycin. It is indicated for the treatment of a number of leukemias and cancers, used to induce regression, available in a liposomal form for treatment of AIDS-associated Kaposi sarcoma. It binds to DNA and inhibits DNA synthesis in susceptible cells, causing cell death. Adverse effects are cardiac toxicity, complete but reversible, alopecia, nausea, vomiting, mucositis, red urine, myelosuppression, fever, chills and rash. Contraindicated in patients with a history of sensitivity reactions to drugs or its components. Drug-drug interaction, calcium channel blockers, may increase cardiotoxic effects. Digoxin may increase digoxin level. Nursing intervention includes monitoring CBC with differential, electrolyte levels, renal function and LFT values, monitoring ECG during therapy. Monitor ECG for changes such as sinus tachycardia, T-wave flattening, ST segment depression and voltage reduction. Vancomycin. It is indicated for the treatment of acute leukemia, various lymphomas, and sarcomas. It arrests mitotic division at the stage of metaphase. The exact mechanism of action is not understood. Its adverse effects includes ataxia, cranial nerve manifestations, neuritic pain, muscle wasting, constipation, leukopenia, weight loss, loss of hair, death. Contraindicated in patients hypersensitive to drug and in those with demyelinating form of Charcot-Marie-Tooth syndrome. Drug-drug interaction includes digoxin, which may decrease digoxin's effects, and morphine, which may increase anticoagulant effects. Nursing interventions include monitor patient for depression of Achilles tendon reflex, numbness, tingling, foot drop or wrist drop, difficulty walking, ataxia, and slapping gait. Monitor patient's ability to walk on heels. Prototype summary cancer cell specific agents is imatinib with a brand name of Gleevec. It is indicated for treatment of CML patients in blast crisis or in chronic phase after interferon alpha therapy, treatment of patients with KIT-positive malignant GIST, first-line treatment of CML. It is an tyrosine kinase inhibitor that selectively inhibits the BCR-ABL tyrosine kinase, blocking this enzyme inhibits proliferation in NBSP, induces cell division. Adverse effects include nausea, vomiting, bone marrow suppression, heart failure, headache, dizziness, edema, and rash. It is contraindicated in patients with hypersensitivity to imatinib or to any other component. Drug-drug interaction is ketoconazole, itraconazole, erythromycin, clarithromycin increase imatinib plasma concentrations. Nursing intervention is monitor for SAMP, ESA fluid retention. Weigh daily and report rapid weight gain immediately.